All right, so when it comes to the doctor wait list and healthcare here in the province of Nova Scotia, the numbers are grim and not improving. That's an understatement. Joining us to talk about all of this is Claudia Chender, Nova Scotia NDP leader. Claudia Chender, thanks for doing this today. We appreciate your time.
Good morning, Todd. Happy to be here.
All right. So, yes, the numbers, over 160,000 people now on this wait list, and in some particular areas, that number, depending on where you're at, the number represents as high as 30% of the population in South Cumberland. Now, behind all of these statistics and all of this data are people. And you spent some time recently out talking to some of these people who are impacted by this. Tell us what some of the stories you've been hearing from people at some of these walk-in clinics.
Yeah, I think you hit the nail on the head, Todd. I think, we get really caught up in this conversation about numbers and percentages. And at the end of the day, it's Nova Scotians who just are, in many cases, really kind of desperate and dismayed because they don't have the healthcare they need. And so we really, we have some conversations. We certainly get emails and talk to people in our offices. But we know that right across the province, where there are these precious opportunities for primary care, whether it's a mobile clinic or a walk-in, there are lineups of people. And we had been hearing about this, that sometimes 2-3 hours before a walk-in opens, there's a lineup. So we, kind of did a little experiment, and we tried to figure out, what if we woke up this morning and really needed to see a doctor? What would we do? Well, we went on the app that the government has promoted, and there was nothing. There was nothing there.
All right, so this is, sorry to interrupt you, but this is the Your app, because there's a Maple as well, so I just want to make sure which one you're talking about.
So the government has the Your Health Nova Scotia app, which is supposed to navigate you. It's basically a search engine. It's not much better than Google. But the reality was that if you didn't or couldn't access virtual care, which lots of people can't, we spoke to people in line who were seniors who either didn't have a computer or didn't feel comfortable with technology. We talked to another person in the line who said that, they actually had given up on the virtual care that was free because they still had to wait. And so, they talked about how this is the beginning of two-tier healthcare, because you can pay for a Maple subscription and get access to a doctor. But if you need one and you don't have the means, well, you're waiting in the virtual world just like you're waiting in the real world. So what most people do, especially in HRM, is they'll just go line up at a walk-in clinic. And so, one of the clinics we went to, we arrived, I think, around 7:30. People had been there. It opened at 8:30. People had already been there for over an hour. And the people in line had circulated their own sign-in list because they knew that once the administrators of the clinic arrived, they wouldn't take everyone. And so they wanted to be fair to the people who had arrived on time to make sure that they were documenting who was there first. And sure enough, when they arrived to open the clinic, they handed the woman a list with 20 odd names, and she said, "Sorry, we can only take the first 15." So other folks will have to come back. We talked to people who had come the day before, were back earlier the next day. But the healthcare stories we heard were harrowing. Over half of the people we talked to were healthcare providers themselves, a psychologist, a nurse, a CCA. They were all missing work to line up and try and get their own healthcare needs met. We talked to people who needed referrals. We talked to a woman who had a 7-week-old baby and was recovering from her C-section. She had passed the window where she could go back to the IWK if she had a challenge, so she had to go and try and see a physician. Just really heartbreaking stories. People were concerned and upset and angry that they had been waiting so long for healthcare, which, they frankly feel like in our country, in our province, with the taxes we pay and the legislation we have, they should have access to.
Yeah, maybe the health minister, Minister Thompson, and the premier could do the same thing, and might be an eye opener for them to do what you've done. I applaud you for doing this. By the way, I think it's what better way to truly, again, get away from statistics and data and talking points.
Yeah. I'll be honest, Todd. When we first started talking about doing it, I felt a little bit nervous about it because, you don't want to intrude, particularly when people are not feeling well or people are in a challenging situation. You don't want to take advantage of that. But as you say, I think we felt like it's so important to hear from people themselves what they're experiencing and how they feel about it. We hear a lot from the government about how they're making progress and how good things are, and that just doesn't match what we see on the ground. And so we wanted to test that and talk to folks. I think the Premier said in the last legislative session, well, not everybody needs a doctor. Some folks feel like they don't need one. I have yet to find anyone who would say that. And everyone we spoke to without fail was glad that we took the time to talk to them. And so I agree. I think it would be a good thing for the Premier and the Minister to do and to start to be a little bit more honest about where we are. And where we are is that over 16% of Nova Scotians don't have attachment to primary care. As you said, in places like South Cumberland and parts of Pictou County, in Halifax Citadel, where I am, that number is well above 20%, can be approaching 30%. That has huge implications, of course, for people's health and well-being, but also for their ability to work, for their desire to stay ultimately in this province. And, from our perspective, everyone I talk to in healthcare agrees that the number one priority of this government, if they're going to fix healthcare, has to be to attach people to primary care. And it's not what we hear them talking about. We hear about machines and investments and access and deals with companies like Maple and Loblaws for, access to shoppers' pharmacies. But what we don't hear is about more collaborative care, doctor clinics that Nova Scotians can be attached to, that have their file, that can make the referrals, that can keep them out of the hospital and keep people healthy.
All right, and also population increase is part of the challenge, is it not? Or it's adding to the challenge, has it not?
It has, but I think a lot of this is that we just, the Nova Scotia Health Authority, and this definitely goes back to the Liberals, just didn't plan for the demographic changes that we're seeing now. So absolutely, our population is growing, but, the government would have you believe that started 3 years ago, and it actually didn't. It started before that. Certainly, we got a surge with the pandemic, but we also know that we have an aging population. We're inching the numbers downward, but we've had a wave of retirements, and we see the statistics on the list. So over half of the people who have been recently added to the list are people whose doctors have retired. So we have this wave of retirements. We didn't deal with that when we should have by planning for succession 10 years ago. And so, now we're playing catch up. But, I think what we see is a government focused on remaining in power, focused on handing out goodies to their friends and in the places that they think are electorally useful. We don't see a strategy to shift this system so that people have attachment to primary care, and that needs to be the number one focus.
Okay, let me ask you this, Claudia. Look, we know that the problems are vast, and we could talk, I'm sure, for 5 hours and outline this in more detail. But and it's hard to kind of come up with solutions in 2 or 3 minutes. But what would be your bullet point item strategy to deal with this as the Premier of Nova Scotia?
I think it's about focus, Todd. So I will give the government credit. We are seeing new collaborative care clinics open. So even in my riding in Dartmouth South, we have a Dartmouth South primary care clinic. This is staffed by allied health professionals. I know they're recruiting a doctor, but they've got nurse practitioners. This is the right model. Right now, that clinic is only available to people referred through virtual care or Maple or from hospital. What we need is to have a almost laser-focused approach on expanding those clinics and those spaces and attaching Nova Scotians to that care. And, that might come at the expense of a few other things, but the reality is that that directly keeps people out of hospitals. That eases the pressure on our paramedics. I think the more upstream we can be with our interventions, and of course there's even more upstream than that in terms of looking at public health, in terms of looking at population health. I think we're on the right track with things like school food and making sure that people stay healthy in those basic ways in terms of the social determinants of health, where often the investments are much less and have a much bigger impact. But when it comes to healthcare, we need to focus on attaching people to primary care. And I think that's really the bullet point, Todd, is, we are paying millions of dollars to, as I said, for, deals with Loblaws, for deals with Maple. That can be helpful. Those access points can be helpful, but they are not sufficient. And we need to acknowledge that, and we need to pay attention to the fact that for many Nova Scotians, and we still have a population that is aging and that has some significant health challenges, having that ongoing access to care will save us money down the road, will save lives, and, is what Nova Scotians expect and deserve.
Okay, Claudia, I appreciate your time. Thanks so much, and we'll be in touch.
Thanks, Todd.
All right, take care. Claudia Chender, leader of the NDP here in Nova Scotia.